This paper is called Homelessness Prevention for Refugees, Results of an Analysis of Pathways to Shelter. So this one needs a bit of context because every country is different in terms of the intersection between the refugee or migrant population or asylum seekers and our social services such as emergency shelter systems. This research was conducted by a team from the School of Nursing at Western University, the School of Nursing at Fanshawe College, as well as Vicki Esses and her team that looks at settlement and pathways to prosperity, also based out of Western University. So in the Canadian context, refugees have access to our social services while their claim is being processed. However, the other complexity is that there are different categories of refugee. So there are what we would call asylum seekers or refugee claimants. These are people who show up at a entry to the country and make a claim of refugee status, and then that claim is processed over a period of time and a decision is made. However, there are also government-assisted or privately sponsored refugees. These are refugees most often who are living in a refugee camp overseas, who are identified by either the government or by a private sponsorship group, and who are brought here intentionally as refugees. And so there are different sort of pathways into the country to begin with, let alone how people end up in shelter. Another piece of background is around the homelessness serving system. So in general, the homeless serving system is not really well set up to support people who are asylum seekers, refugee claimants, and particularly often have limited supports around language barriers and interpretation, don't necessarily know the complexities of the immigration system, so don't have a lot of help to offer in terms of managing people's tasks to deal with their claim. And so in general, emergency shelters tend to prefer not to work with this population. And in cities like Toronto and like Montreal, which are cities where many people come to when they come to Canada, they often have quite a large population of newcomers in the shelter system, and in general would like that to be smaller. Again, because they are not really well set up to manage the types of challenges these populations face. And so for this research study, we were invited to 2 family shelters to speak to refugees who were in that space to understand how they came to that space. And this was being conducted with an idea of sort of shelter diversion. So it was a chance for us to think about, are there other ways, processes, or pathways for refugee families other than access to emergency homelessness shelters? So to do this research, we spoke to the families, and we spoke to them a number of times throughout their stay in shelter. We also talked to shelter staff about their experience of working with refugees. So the first important finding from our research was who we ended up talking to. In almost all cases, we were not talking to government-assisted refugees or privately sponsored refugees. So it's important to note that folks who are coming in as refugees but are being invited in and being supported into the country, the majority of them are finding housing. That housing may not be perfectly stable, may not be quality housing. They may be doubled up or they might have to move. But again, those folks are far less likely to end up in emergency shelter. And those who were ending up in emergency shelter was for the same reasons that Canadian citizens end up in emergency shelter. family breakdown, intimate partner violence, crises related to substance use, for example. All the same sort of pathways and very infrequent. The vast majority of the people that we were talking to about their coming to shelter were people who were refugee claimants. So they were people whose status was still precarious in the country, were still waiting to hear if they were going to be allowed to remain. And in that context, we're in this sort of liminal space, or this sort of limbo, where they were limited from other activities to sort of change their life situation because they didn't know what was going to happen next. And so in talking with those families, the first thing they told us was that they were coming basically from nothing with nothing. So to precipitate a move, often a move across the world, to a new country where many of them had limited knowledge of the language, of the culture, or limited preparation for the weather, that's a huge choice to make as an individual, and is made in the case where there was really no other options. And so folks were leaving war, leaving violence, and leaving after they had exhausted all of their other resources. And so many were arriving with no financial resources from which they could possibly pay for a rent. And in that case, they were also arriving with limited knowledge of the system. So with no money enabling them to rent a place, shelter was an obvious solution, and they were often guided to shelter even by folks at the port of entry where they arrived as soon as they declared that they had no money with them. So Canada Border staff might refer them to a shelter service. So then in arriving at the shelter, well, the shelters were not set up primarily to support this population. They at least could give basic guidance in terms of access to health care for people who had refugee status. They could point people to their social assistance office so that they could get an income starting to support them, a very basic, the minimum Ontario Works income, but some money. Connect them to education services, to where to go to talk to settlement, to get language access. And so in that case, the shelters were at least connecting people through to the help that they needed. And so then the third thing we learned is that after often years of horror and chaos, of displacement, of death, of loss, of poverty, of starvation, the shelters, although they're not the best spaces, did become a space of some stability and peace, where at least they knew they had a safe place. Those with children had a safe place for their kids and had access to food and other basic needs. And so these spaces became a place for them to stop and to catch their breath and to start organizing their lives and thinking about how they were going to move forward. So interestingly, as we understood the pathways for refugees, we understood that it's a particular group of refugees who are ending up in emergency shelter. And while the shelter's perspective was generally that they were not particularly enthused to support this population, it was our conclusion that this is actually the right place for this particular category of refugee, because it was a place where at least they and their children could be safe for a time, could get connected to the right services, and could get help in terms of moving into better places for them and their family while they wait for their claim to be processed. So in conclusion, we actually determined that shelter diversion is not the right concept to be thinking about how we deal with refugee claimant families who have no other resources. Instead, we should be thinking about how we have enough space to invite them in so that we can meet those basic needs and connect them to the services that they need. So as long as we're thinking about the fact that there are different categories of refugee, and one group of refugees are coming to this country with absolutely nothing, then shelter is actually the appropriate space. And so instead of trying to push people away from the shelters, we should be making sure we've got enough capacity for the people who are in need. In terms of future research in this area, it is important for us to think about positive settlement. So not only do we want refugee families to have their basic needs met, but of course we want them to successfully settle in the country if their claim is supported. Therefore, some long-term research looking at how refugee families exit shelter, where they're exiting to, what type of housing they're able to access, and how they're able to make that housing work would be a really important next step and might provide some good recommendations for shelter workers so they can better support these types of families.